Hi, everyone. Thank you so much for joining us today. Before we get started, we're just going to go over a few logistical things. If you can look at the bottom of your screen, if you would like Spanish interpretation, there's a button that you can click to select your language. So please select the language that you would like to listen to, either English or Spanish. Si quieren escuchar la presentación en español, hay un botón en la pantalla y se puede elegir si quieres escuchar en español o inglés. And I just want to thank everybody again for joining us today. This webinar is being recorded. My name is Julia Parrish. I'm a senior staff attorney at Legal Aid at Work. We're so thrilled to have our panelists here and to talk about all of the amazing and creative things that folks are doing to help increase access and reduce barriers between and amongst agencies and community-based organizations. This is a webinar format, so if you would please take a moment and introduce yourself in the chat, put your name, organization, we can get a chance to know each other a little bit. And also, if you have any questions throughout, you can use either the chat function, type it into the question and answer box, or raise your hand and we can unmute you. At the end of the presentations, there'll be opportunity for us to have a discussion about some of the ideas that we're trying to implement. And once again, if you need help accessing interpretation, there's a button at the bottom of your screen. You should be able to select Spanish. Una vez más, si quieres escuchar en español, hay un botón en la pantalla donde se puede apretar para escuchar en español. Y si necesita ayuda con esto, puede mandar un mensaje en la charla y le puedo ayudar. So right now we're going to turn it over to Dr. Curtis Chan, who is the co-chair of the Maternal and Child Health Committee, California Conference of Local Health Officers, to introduce the panel. Thanks so much, and take us away, Curtis.
Thank you for the invitation and welcome leaders across the state and country. My name is Curtis Chan, and I'm a pediatrician. I've served families as a physician for over 20 years, so I've seen firsthand the importance of paid family leave, paid sick leave on health, and also the inequities of healthcare access and accessing these workers' rights. Also, as a health official in local government for over 15 years, I've seen how our silos and bureaucracies and state, federal, and local government worsen the health inequities and social inequities. We've definitely seen this for many conditions in health during pregnancies, and we've particularly seen this during COVID. So with that, we're so grateful for the collaboration of these 3 California state agencies working together during COVID, and also working with communities such as the national nonprofit Legal Aid at Work. So we have these fantastic panelists for us. The first panelist you can see identified there is Adam Romero. He's a leader of the California Department of Fair Employment and Housing, as serving as Deputy Director of Executive Programs. Second is Sebastian Sanchez, Associate Secretary for Farm Worker and Immigrant Services for our state's labor agency. Representing the California Department of Public Health, we have Sarah Nelson joining us, who serves as a health communications specialist and served as a campaign manager. And representing the community, in a staff attorney, Katie Witchett from Legal Aid at Work. So thank you so much for your leadership throughout the pandemic. It's made our jobs as a local health official and physicians much easier, and we look forward to working together and listening to how you've collaborated. Next slide. So from a local pediatrician's perspective and trying to provide counseling to families, this is what physicians, public health agencies, and families encounter. Basically, we have fair employment and housing that really ensures that people have that workers have rights. The labor agency, from my broad perspective, makes sure that people have access to paid leave. And the public health agencies tries to ensure health and has connections in health. All these systems do a remarkable job. From my perspective, many times we're working in silos. And from a patient's perspective, they're encountering different policies, different systems, different processes, applications, and education materials of what their rights are. This is the story of these three agencies working with communities for a better process. Next slide. So do you want to play this video highlighting a client story that's been served by Legal Aid at Work?
Sorry, I'm going to try to reshare my screen with sound this time and see if that works better.
I had started feeling a little sick. I was feeling a little off. And in the middle of the night, my fiance ended up rushing me to the nearest hospital. And that's when they told me that I was about 4 centimeters dilated and that the baby wanted to come out. He was at the baby wanted to come out. He was at the time 25 weeks and 1 day gestational. And from there, it was really mind-boggling to me, like really, really to the point, everything was like a blur. And feeling that sense of, uncertainty, dread, and fear mixed in. First thing I thought was, shoot, how am I gonna get a hold of, my management to let them know that this unexpected arrival and my need to activate my maternity leave. But at the same time, I was scared. And then that honestly got shoved all the way in the back of my head because I was more focused on increasing the chances of survival for my son. Once I spoke with HR, I felt like the situation went from supportive to it shifted. It definitely shifted. But for this to happen when my son's life was on the line and I'm in this whole basket of just somewhere between fear, despair, anxiety, frustration, depression, and uncertainty, I really felt like that all just kind of fell apart from the bottom, and they didn't really, in a way, support me how I was expecting it. I really felt betrayed. The head surgeon who specializes with micropreemings had directly called me and said, you need to come in. I believe he's in bad need of surgery, and if he doesn't receive the surgery, he can potentially get even more sick within the next several hours. I felt like I got slammed, by a freight train. And then all of a sudden, and out of nowhere, I get terminated. I had received that during his surgery. I had received a notice during his surgery, and I got so mad, I literally had to just leave the room to breathe. So you can imagine the amount of stress getting piled on of just, oh crap, I just lost my job. My son's in surgery right now fighting for his life. How do you climb out of that hole? Especially when you have an obligation to your job, but then you have an obligation to yourself as the person who's going through this trauma, and an obligation to your family. My attending doctor, who was going through the approval with EDD, had said that she felt like something was off, and I'm not understanding why they had terminated you while you're on leave, but I would strongly suggest that you look into it. At the time, I had so much on my plate, and I didn't want to go through the whole seeking legal advice and having to talk with an attorney. But after much continuous mental straining from not having a job, and then of course my personal funds going down, my therapist in particular was like, give it a try. She's like, it's important that your rights as a worker are protected, especially when you are a parent of a NICU baby and this is going on. That's the last thing that should have been on your plate. Family leave, I believe, is very important. It's critical because it allows the parents to be there and to focus on their child in the NICU. It could be basically a big difference between being able to be at the bedside of your child or being in the position where you have to go back to work. A lot of the bulk when it came to FMLA or paid family leave was primarily through your social worker. Even if a NICU doctor isn't as knowledgeable as a social worker when it comes to the ins and outs of paid family leave, they could approach the social worker and say, hey, Dr. So-and-so mentioned that there is paid family leave available. How can I start that process and when can I start it? So I encourage a lot of parents of NICU babies to be able to reach out to their hospital social worker as soon as possible and see what they qualify for. And if they have any hiccups in between with communications between their job management or HR and that of the NICU, the social worker becomes that much as an important. I hope that, with my story and my son's story, that there are people, loving, caring, supportive people out there who are willing to step up to the bat and support them 100% of the way. I want parents to remember that their job primarily is to be a parent, and don't be afraid to speak up when you're not sure about something. Because if I wasn't encouraged to speak up, again, we would be talking a totally different tune and situation. A year ago, I wasn't sure if he was going to even make it before he came out. To see him so vibrant and full of life, I am very grateful for everyone who has been involved in this journey and continues to be supportive as my journey and journey with my family continues on.
So thank you, Noelani, for sharing the story, linking directly paid sick leave to health. And Sarah Nelson's going to describe that this linkage is not just for pregnancy and family leave, but her work at the California Department of Public Health shows that these same principles are utilized for sick leave due to hospitalizations, cancer, and even for COVID supplemental sick leave. So with that, from Sarah Nelson from the California Department of Public Health.
All right. Thanks for sharing that video. It's definitely, I think, a big reason why we do the work that we do. So I think that was a really great way to start out today. I'm assuming you guys can see my screen, so I'm going to go ahead and start out. I want to thank you for allowing me to kick off today's meeting, today's webinar, with an overview of partnerships, in particular our partnership with Labor and Workforce Development Agency over the last year and a half at least, and how we were each able to kind of move out of our silos. These are our silos here, and collaborate, in particular during this unique time of COVID. I can definitely say for my part, had we not been able to collaborate with labor, we would not have been as successful as we were. So I'm in the occupational health branch at the California Department of Public Health. As our branch name suggests, we deal with making sure that workplaces are healthy and safe places. And in the end of 2021, early 2022, or excuse me, the end of 2020 and then early 2021, we were in the middle of planning a media campaign that would be targeting workers that were at high risk of being exposed to COVID in their workplaces, and wanting to reach those workers with different messages about workplace protections, about access to vaccines, that sort of thing. And so we were definitely in the middle. That's kind of a hard time to be able to shift things a lot. Come to find out that labor was also doing, they were in the middle of their own campaign. They were also going to be targeting the same at-risk workers, and they were also going to be doing that at the same time. And so that kind of was like, oh, wow, okay, doing these two different campaigns, we're both in the middle of them. What does that mean? But more than anything, I think we saw that as an opportunity. I know that I did. And then when talking with labor, I think it was both looked at something like, okay, there's some opportunities here, because big picture, what's most important is we wanted to get out really critical and important information to vulnerable workers as quickly as we could. But certainly it also provided, we had a lot of considerations. There's a lot to think about since we're both in the middle of our two campaigns. How can we work together? Some questions that came up were, would our messages align? Would one campaign maybe drown out the other campaign a little bit, not intentionally, but just by the nature of it? Labor's was going to be a much larger campaign than ours. What would that look like? And I think, even if we really wanted to work together, could we? I mean, we were so far along, and in COVID, I think we all probably know it's very hard to shift things because it had to happen so fast. So even if we wanted to work together, could we? I think we all know that this webinar, a huge focus of it is on how we did collaborate together. So you can assume that yes, we did. We did end up doing that, and we could say that we had really good success with that. We brought our silos. Maybe we didn't totally break them down, but we brought them closer together. We built some bridges across that. And so what I'd like to do is, I want to start by sharing a few ways that we were successful. I'm going to give you 3 examples of success. There were more than this, but just to give you just an idea of how we worked with them. So one way that partnering with labor was just really a great way for us, and also for them, was we could expand our reach to different groups. So at CDPH, our plan was always to use our organic channels, our partnership channels, which we had, but not as extensive as what labor had. But by partnering with labor, they were really going to be opening the doors to their 60+ grantees, plus they're working with other grantees, opening the doors to those, and each of those organizations was then serving hundreds of different workers that we were needing to reach and that they were reaching. Labor also was like, they would have regular calls with their grantees. They would keep them filled in on our campaign and their campaign. So it wasn't like this competitive thing. It was very much about sharing what was happening across both. They would do their e-blasts and also share information about our campaign and post our information on their site. On the left here, you see an example of one of our social media graphics. Another great success with this project was that we were able to have a home, a place where we could send people to. So if you see down here on the bottom left, learn more at Safer at Work. That's not a CDPH site. That's LWDA's site. And so it's probably not super common across big institutions that you're just going to send all of your paid media to someone else. But, and when it came to very specific health-focused things like vaccine promotion, we were sending them to the CDPH site. But when it came to workplace protections, there was no way that we were going to be able to develop such a comprehensive library of information about workplace protections that would be valuable to people. So this was an example of, we talked it out with labor. What's going to be most beneficial for the workers that we're serving? And it just made more sense to do it this way. So through different discussion and planning, that's how that ended up. One additional example here, this is an example of a digital scrollable story that we created, which in the end, it ended up like has a lot of things moving, you're scrolling, things change sizes, and it was actually complicated to kind of host and display that on just any website on the CDPH site. Because of our web template, it was going to be probably near impossible or take a lot of time to figure out how we could display it. Again, we turned to our partner at Labor and we had discussions. In the end, they hosted and displayed it, and they still are doing this. Now, for us to get to this point of success, I wanted to kind of go over a little bit of how we got to that point. So I'll look at a few kind of models of collaboration. This is probably one that we're all familiar with. This is how it commonly happens when we collaborate. Starting on the bottom, we form teams, we coordinate with each other, we act, and through acting, we're reaching different goals. This is a good model, but I think we probably know that it's more of like kind of tip of the iceberg. It's what is highly visible, but there's a lot of things that happen below this that are equally as important. And in fact, the things below this are the ones that build up to making these ones at the top successful. So these are the ones here below the surface. They can be less visible. So things like finding ways to participate, sharing what you know, discovering people, connecting, contributing. I think sometimes these are viewed as like soft skills in organizations, and maybe can be a little undervalued, not necessarily everywhere, but perhaps we don't place as much emphasis on what happens in these. But these are really ways that it's like social connecting with people, social collaborating, getting to know people, building that trust and engagement. It's how we find and discover opportunities. And it's that social piece of it. These can happen naturally. They most commonly happen naturally in the same workplace with the same teams, the people that we're seeing often. If we're actually going into a workplace still, it might be the area that we sit next to each other, like the cubicle area, that your area of the floor, whoever you're working a lot with or you see at lunch. Even in your own organization, there's silos, because you might just be working with this one group and you sort of forget that somebody else is doing something fairly parallel and you don't come together. But think about that, let alone across large institutions like in government. How do we build in making yourself visible, sharing what you know, finding and discovering people? And I think something else that we need to think about here is, since COVID, and we maybe are working hybrid, sometimes we go into the office now, sometimes we work from home, perhaps many of us are working at home. Have we in some ways lost opportunities to do these things? I think that's something important for us to consider. Sometimes we hop on a Zoom call and you focus on your team, you're coordinating and you're acting, and you sort of forget about these natural steps that need to happen before all of that happens. So that's one question to ask ourselves. Are we building in time for these things? Are we training staff on how to do these things? I think when things are called soft skills, there's an assumption like people just know how to do it, or it should be easy, it just happens. Sometimes it does. Sometimes it doesn't. Sometimes people don't know, like, what is the practical step for me to find and discover people? Like, how at the end of the meeting should I do that? Oh, if they provide you 5 minutes to make an announcement, make the announcement and maybe say, hey, I would love to meet with anybody that might just like to talk about this more. So it's stuff like that, I don't know, is some of that perhaps getting a little bit lost in the mix. And so then within this collaboration pyramid, I just wanted to highlight two areas that make yourself visible and participate, and then the find and discover people. So when I was working with labor, I was working with Young Sung and Sebastian, and we did all of these. We were very much putting ourselves out there. But so in particular, highlighting these two, with Young Sung, she was out there making presentations about the different projects and campaigns that they were going to be doing. It wasn't just within labor. She was out there doing it in different places, and that included CDPH. That's how I heard about her. I was really interested. I asked a lot of questions. I asked to have meetings with her and her team later. I kind of pitched our ideas. Look, we have a smaller campaign, but I think there's crossover. How can we work together? So by focusing on a lot of these 5 areas, through that process, what naturally happens is you learn, okay, what are your shared purpose, values, and your motivation? And then we agreed together, like, yeah, it is going to be mutually beneficial for us to be able to combine our projects in some way. It didn't mean that we were going to have just one campaign. At that point, like I said, we were in the middle of ours. They were in the middle of theirs. We didn't need to complicate it. We did need to try. yeah, but we did need to try to do it in a way where there could be some overlap and aligning, where we could be a voice for them and they could be a voice for us. So that was a really key piece of this lower part of the collaboration pyramid. The upper part is also important. I'm not trying to suggest it's not. It's just we have to have these things built in on the bottom to really have success at the top. What worked really well for us with working with labor is the coordination and acting phase. During COVID, again, when you start to place yourself in that, the chaos of COVID, quick timelines, get it done now. We can never stay in front of the message, do it now. The way that it worked well for us was that labor, and then we also adopted a very much like, yes, and let's figure out how kind of mentality. If it was the kind of thing where it was like, yeah, I don't know. I mean, maybe, and we need to have 10 meetings to figure that out. I mean, there was no way that that was going to be possible because we didn't have time. It had to get done. And so something I really appreciate about working with labor was it was like, that makes sense because that's what's going to be best for the organizations that we're serving and the workers that we're serving. So let's figure out how we can do that. And then that didn't mean that we had to make rash decisions. We could still have very quick but thoughtful decision making. And that definitely happened on our leadership level as well at CDPH. And I think we all recognize that the only way this would be able to happen was by having expedited reviews. There was just no way around it. So I hope that provides a way for you to understand, how we were able to do this with labor and how it allowed us to have success. It was success for both us and for labor. And I will now pass it on to Sebastian, and he can kind of provide a little bit more from his perspective there. Thank you.
Thank you, Sarah. I really appreciate you sharing how we were able to develop our relationship and really be able to execute on sharing the information that your team developed and really quality illustrations and graphics and infographics that were just really tremendous. So I want to share with you all a bit on our Safer at Work campaign and specifically talking about two aspects of that, our COVID-19 Workplace Outreach Project, CWOP, as well as our Worker Benefits and Leave Navigator that we developed throughout the campaign. Overall, the Safer at Work campaign was launched in about August of 2020, September of 2020, when we received funding from the state to address COVID-19. We engaged, we had a campaign for paid and earned media. We did social media. We developed trainings with various partners. And we also had just direct outreach to community members. I'm hoping that through this presentation, I can share with you all some of the challenges that we encountered in getting this presentation off the ground. Also sharing with you the impact and the importance of working with partners outside of labor agency, both in the state and outside of the state. So with that, if you could take me to the next slide. So our campaign was meant to reach individuals in specific industries, what we termed at that time essential workers. We were targeting workers in agriculture, in grocery stores, in restaurants, in warehousing, workers that were being directly exposed to COVID-19, and they were being disproportionately impacted. These were workers, immigrant workers, low-wage workers, people with difficulties accessing health, and that had to go to work, had no option. And we wanted to create information and material that would be able to effectively educate them. It had to be accessible for these workers. We wanted them to understand what the risks were and what their rights were in the workplace. We wanted them to get vaccinated and have information once that developed. And we really wanted to create content that would allow for interaction with workers. So next slide. We had to think through the variety of content and the source of content that we were going to address. We realized, and labor agency oversees more than just these 3 departments. We oversee 7 in total, but these were the key ones that were providing us information. And I laid out under the department some of the some of the divisions and branches of each of the departments that we had to engage, just to give you a sense of the scale of the number of entities that we had to work with to ensure that we could get this information out to the public. From an outsider's perspective, and I'm relatively new to government, as many of you all know, when I always imagine, oh, the labor agency, it's very easy. We can just reach out to the labor commissioner's office and tell them to, give us X, Y, Z. I've come to realize that in government, each agency, each division, each even branch or unit within a branch has a tremendous scope of work and that they need to be covering. So it is very difficult to ask one unit, let alone an entire division, to focus their efforts on doing a new campaign or doing work. So we had to do a lot of upfront work of communicating, working with these various partners, the leadership in each of these entities, to get them to share in the vision for the campaign, get them to buy in, and get them to get this down to their staff, to let them know why we were doing this, why we all of a sudden they would be receiving requests for work. On top of that, we knew we needed to engage external agencies and departments outside of us, including DFEH and CDPH. And that, again, isn't just contacting another department, you're also working through their own internal bureaucracy of what their agency and what their agency requires them to do. So this was a lot that we needed to figure out how we would engage, what efforts we would do to connect everyone here. And I really appreciate Sarah's description of what Youngsun, our former supervisor, Youngsun Park, was doing in terms of getting out there, communicating with each of these agencies, really providing information to them about what our vision was and trying to build that buy-in. Next slide. We also knew that we couldn't just work within the state. We realized very early on, the vision was that there were a couple specific challenges. The content that we were creating, the way that information was being distributed by the state would not be the most effective way to reach the workers we wanted to target. So we knew that we had to create CWAP. We had to fund CBOs to do the direct outreach. We wanted trusted partners, groups that had those ties to the community, that understood the audience we were trying to reach, groups that would expand our capacity. We have state offices throughout the state, but we're not present in every single one of these communities. We needed groups that could target and identify where these essential workers were that we wanted to reach. And also, California is a state of immigrants and has a lot of languages that are spoken, and the state does not have that capacity to reach them. So we knew we needed partners that would help us with that. On top of that, in terms of creating content, creating information for workers, I'll share a couple slides in a bit to kind of demonstrate the differences in what we, how content is created at the state and what we try to do. But we partnered directly with a couple of the labor and occupational safety and health programs at UCLA, at UC Berkeley. We ran a specific program with UC Davis. I see the team from the Western Center is on this call. Hello. And with Legal Aid at Work, we also entered into contracts to create content that we thought would be accessible to these workers, that would really bring in a breadth of understanding and knowledge that went across the board, that wasn't just siloed to a specific department or division. We wanted people that understood that these issues and an issue of paid leave was connected to disability insurance, connected to paid sick leave, was connected to health and safety in the job. So we really knew that we had to contract and ended up contracting with various external partners to provide this technical assistance. Next slide. So I use this as an example of one of the biggest challenges we had, and I think one of the most important things that has come out of the Safer at Work campaign is understanding at the state level, or incorporating into our practice at the state level, developing content that is accessible to workers. Frequently what the state does is create a web page that has a lot of text, has a lot of information, And they have a different audience, right? These websites that the state produces has to be accessible, not just to the target population of Safer at Work, but also the California workforce as a whole. So they have a difficult job in creating content that is exhaustive, that is correct, that addresses every single possible issue. But I think as advocates know, that's not the information that is most useful to workers. So I like to compare these two different things that were created on accessing disability insurance. On the left is what EDD provides on their webpage. On the right is something that we created with Legal Aid at Work to provide information to undocumented workers on accessing paid family leave or disability insurance. And just the look of it, I mean, there's still a lot of words on the document that we created with Legal Aid at Work, but just the look of it, the feel of it is more accessible. It's something that we knew advocates could quickly explain to workers, right? Rather than requiring workers to go read a textbook and scroll through different links to get the information they need. And this is really what we were targeting and trying to do through this campaign, is really developing content that would reach workers, that was accessible to workers. We had even more simplified stuff. We had just, for example, the Western Center produced these flip charts that had just basics on what health and safety looks like in the agricultural workplace. We had specific infographics on the emergency temporary standards created by UCLA that really broke down the ETS rather than just these text-heavy images and websites that we tend to create at the state level. Next slide. So just to show the impact, again, on the left is something that was recently put together. It's the FAQs that we are very good, I think, at doing at the state level in terms of trying to break down a complex legal issue. But then we also worked on getting information to workers in a new style in terms of a simpler infographic, something that was more accessible. And this was a direct impact from working from our state agencies, seeing what our technical assistance partners were doing and what was effective in terms of distributing what our partners on the ground were telling us needed to happen. Next slide. Another way that you could see the impact is the Safer at Work microsite that Sarah was referencing. This was a challenge for us to create something where we could combine information from multiple sources, right? Where if a worker had a question about vaccines, they didn't have to go to the DFEH website to know whether or not their employer could ask them about their vaccination status, and then go to the Labor Commissioner's website to figure out what kind of paid sick leave they could take if they had symptoms from the vaccine, and then go to Cal OSHA to figure out whether or not they had to, their employer had to let them know about other workers' vaccination status, right? So we wanted to create sites that brought together all this information. It really required us to communicate heavily with external agencies. We were sending summaries, we were looking at all the materials that were being created by these specific entities, drafting summaries, sending them back to the specific entities. I know Adam reviewed the text on some of this stuff. We were constantly reaching out to different agencies to create a user-designed website that would be easy to access for workers. Next slide. Additionally, this really changed our ability to do outreach. By working with community partners, with groups that had on-the-ground knowledge, we were able to create models, including our farm worker caravans and a week of action that would allow us to have a substantial presence in collaboration with CBOs in specific locations where we wanted to reach workers. We had these LED trucks driving throughout the state, blaring information, showing information as to what workers' rights were, and they were really effective at getting media attention to some of the areas that generally don't get a lot of press on workers' rights, particularly in ag-heavy regions. Next slide. The last thing I want to touch on is our paid benefits and leave navigator. This is something that we worked on creating with several partners. We wanted to create something that very easily laid out what were the scenarios that workers faced, give them simple questions to figure out what they were eligible for, and then provide them a summary of the various benefits. And again, similar to the Safer at Work site, we were pulling information from throughout various agencies at the state to make sure that they're in one centralized location. And next slide, in order to achieve this, we had to work with different partners outside of the state. This was not something that we would have been able to do internally on our own. Legal Aid at Work had already done something similar. I know that a lot of advocates are constantly thinking through ideas of how they can make information more easily accessible to workers. Legal Aid at Work had been doing this with a chatbot. They were able to lay out the logic mapping for us, give us that information. They had the subject matter experts that understood the various leaves. They were able to get it to partners to test the navigator very directly, very easily because of their built-in relationships. We had to work with an external vendor to help us create and program the actual navigator. So this was something that required us to really engage heavily with external partners, also rely on our internal state agencies to do review to ensure that it was accurate. But it was really a collaborative process that led to us creating this navigator. And with that, I will pass it along to Adam Romero from the FEH.
Good afternoon, everyone. I am the Deputy Director of the Executive Programs Division at the Department of Fair Employment and Housing, which is also known as DFEH, and it's a pleasure to be here today. This is really a very important topic to me. And for anyone who's not familiar, actually, next slide. For anyone who's not familiar, the Department of Fair Employment and Housing is California's civil rights agency. So we receive, investigate, conciliate, mediate, and prosecute complaints of discrimination, harassment, and retaliation in employment and housing, as our name, of course, states, but also in businesses and other types of public accommodations, as well as any program or activity that receives state funding or is administered by the state. And we enforce the state civil laws against hate violence and human trafficking. And critical to our mission of eliminating discrimination in California, we have a robust outreach and education program, which is part of the division that I oversee. And our efforts in this area have two overarching goals. First, we aim to ensure that Californians understand their civil rights and know about and can access my department services, and that employers, housing providers, businesses, and others within our jurisdiction are aware of their obligations, which are evolving in California. And second, we aim to prevent discrimination from happening in the first place by proactively finding and rectifying discrimination that's occurring without the need of a victim to come forward, as well as working to reduce biases and prejudices that lead to unlawful discrimination. And next slide. And today, I'm pleased to join the discussion about cross-organizational collaboration on outreach and educational initiatives, with the ultimate goal, of course, to improve Californians' ability to access their rights and available services. And at DFEH, we also collaborate with other agencies on investigations, prosecutions, and other activities, but I won't be focused on those today. Instead, I'm going to present on some educational initiatives where my department really benefited not only from collaborating with other state agencies, including labor agency and its departments and divisions, but also local and federal agencies such as the San Francisco Office of Labor Standards Enforcement and the U.S. Equal Employment Opportunity Commission. And I see Linda Lee is in the audience today, and I really want to give her a shout out from the EEOC for partnering with my department on many different programs. And we've also partnered with non-governmental organizations, including Legal Aid at Work. And the case study I want to present is really was focused on helping people navigate interlocking laws enforced by different government agencies. And this is it's a really important goal for me and the rest of DFEH leadership. I have experienced firsthand in my personal and professional life how challenging it can be to fit governmental puzzle pieces together. In fact, when I was first appointed to my position at DFEH, while I was generally familiar with family, medical, and disability leave, I was not particularly familiar with paid family leave or disability benefits available from the Employment Development Department. And when I arrived to DFEH in April 2020, the administration and the legislature were considering expanding the California Family Rights Act to broaden the types of family members one can take leave for, as well as to broaden the employers and employees who are covered by this law. And as you probably know, this proposal was one of the proposals recommended by the governor's Paid Family Leave Working Group. And as I dug in on the legislation to expand CFRA, California Family Rights Act, I started trying to fit the different puzzle pieces together, namely the job protected leave provisions that are enforced by my department and their interplay with pregnancy disability leave, as well as leave as a reasonable accommodation for a disability. And those forms of leaves interplay with federal law, including the Family and Medical Leave Act and the Americans with Disabilities Act. And then we have the interplay with the benefits administered by EDD. And on top of all of that, there was the interplay with paid sick leave and supplemental COVID leave, among other dimensions. And so my colleagues at DFEH and I quickly realized that from the perspective of a California worker struggling to keep themselves and their loved ones safe and fed during the pandemic, and from the perspective of businesses that were trying to keep people employed and trying to stay afloat, we needed to cut through the complexities and layers and do our best with the resources we had available to us to work with other agencies and non-governmental organizations to put together easily understandable information that at least attempts to break down the silos and build bridges, as Sarah mentioned. And our agency, so this was early on in the pandemic, and our agency quickly produced or participated in numerous cross-agency webinars that really sought to fit the puzzle pieces together and sought to answer people's pressing questions. And we did these webinars with the EEOC, with the Division of Labor Standards Enforcement, the Labor Commissioner's Office at within the Department of Industrial Relations. And I think those were very successful in getting information out quickly in a way that, again, had these different agencies working together to try to help people navigate these laws. And then once California enacted Senate Bill 1383 in September 2020, which substantially expanded the California Family Rights Act in the way I mentioned before, our agency jumped on updating all of our online and print resources in advance of the January 1st, 2021 effective date. And as we did this, we recognized we had this amazing opportunity to work really intentionally to break down the silos in this area. And so we purposely reached out to our colleagues at Labor Agency and at Legal Aid at Work and other organizations for feedback on the drafts and to understand what might be useful. The results were nested on this webpage that you see here, which is a toolkit of resources. And I also want to mention that prior to this, DFEH's own relevant resources were scattered a bit across our own website. And that didn't make sense. And so we moved everything to one place. But these materials are also available other places you might expect them to find them on our website. And we also added cross-links across several of our pages to improve people's ability to find this toolkit. And so what do we have here? As you can see in the first column are resources related to the California Family Rights Act leave. And the second column has resources about pregnancy disability leave. And next slide. Among the printable resources available are two fact sheets that explain in clear and accessible language how these forms of job protected leave work, who is eligible, and other important information. And one feature that we added to these materials based on the cross-agency collaboration was a section in each of the fact sheets about benefits available from EDD. And we directed people to where they could find out more information. And we referenced different forms of leave that our department enforces, again, to help people see how the different puzzle pieces fit together. Next slide. Another resource we created, which you see here, is a matrix that answers various frequently asked questions about family and medical leave available under California and federal law. And California law is generally broader and more protective than federal law. So again, we sought to break down for folks the similarities and differences. And next slide. And here I just wanted to highlight that on this resource, we also included information about the EDD administered benefits. Next slide. And we similarly created a matrix for frequently asked questions for new parents and expectant or recently pregnant people. And next slide. Again, highlighting benefits available through EDD. And next slide. So just in my last minute or so here, this is the toolkit that we looked at before, and the matrices are linked in the third column here. And we've also linked to resources available from Legal Aid at Work and from the labor agency, the Leave Navigator that Sebastian mentioned. And fourth, I just want to highlight the fourth column, an interactive app that my department developed and published to help people understand their rights to pregnancy, disability leave, and baby bonding leave. And here, I just want to echo what Sebastian said about government agencies doing, putting a lot of text-heavy information out there and needing to find other strategies to reach people through infographics and interactive tools. And so this is just one example of, I think, a way that we've done that. Through this app, your user is walked through a variety of questions, very simple questions that help them understand if they're eligible and how they might utilize their rights. And I think I am just about out of time, so let me just end there and say our department is constantly looking for ways to improve, and so we are all ears for ways in which we can do our best to help connect the dots between the laws that our department enforces and those enforced by other departments. And with that, I will hand it over to Katie at Legal Aid at Work. Thank you.
Thanks, Adam. And thanks to all of the other panelists. I'm very honored to be here with all of you. And I know that your creativity and thoughtfulness and collaboration, especially through the pandemic, has enabled so many people to take time off and know that their job is safe, which we know with COVID-19 is not only important for their health and their family's health, but also for the public health. And we've seen studies showing that in states that newly started paid sick leave in 2020, the implementation of that policy prevented one case of COVID-19 for every 1,300 workers. So that's many, many people across the country. And that fits with what we've seen from paid family leave and studies on its impact as well and how it improves health. And that's to say that a lot of that is a background for why the Work and Family Program at Legal Aid at Work does what we do. So we focus on making sure that workers can access the time off, accommodations, and pay that they need in actionable and accessible ways so that they can take care of their health and their family's health without having to sacrifice their income and their job security. And it does involve a lot of different agencies. And we've seen that the impact of that is that a lot of workers might not, first of all, learn about their rights without the help of those working in healthcare. because they might not have the time and availability to research their rights or to especially check out a bunch of different government websites. But we've also seen that healthcare providers are key for making sure that people feel comfortable accessing their rights, because workers who are marginalized, whether it's because of a language that they speak or limited literacy or other reasons, might rightly be afraid of standing up to their employer. So for a long time, Legal Aid at Work has been partnering closely with healthcare providers, knowing that they can be the ones to, at the first step, introduce their patients and clients to the concept that they might have workplace rights that can protect their family and their health without having to sacrifice their job. It's healthcare providers who are often writing the certifications to make sure that people can access these protections. And then finally, to also be able to refer people over to community-based legal aid organizations like Legal Aid at Work and so many others across the state, so that people know if they stand up to their employer, whether or not it works well, they won't be standing alone. And all of that is kind of backup for why we created Pregnancy Plus My Job. So this is a one-stop fact sheet that covers all of the rights to leave and to pay and accommodations for people who are pregnant or new parents, all in one place. And to make it effective, we focus grouped it with healthcare providers across San Francisco and other community health workers with the partnership of Dr. Chan. And we also focus grouped it with just people in the community and workers to make sure that it was something that they could understand. And it's been effective. We know it's posted in the cubes of many healthcare providers across the state, and that's something that we're really proud of. And next slide. And as a part of that, we also, from listening to the community, created a more graphic kind of step-by-step tool that goes through all of the reasons that people can take leave and get accommodations, and just like what to do from the start of your pregnancy through each step moving forward. And apart from this being a wonderful tool that I wanted to share with you, this is also to provide some context of where we were positioned when the pandemic hit. We'd spent years trying to connect these rights across agencies to leave and to pay and to accommodations, simplifying and interpreting that information in a way that workers could more easily understand. So when the pandemic hit in March, we partnered with Dr. Chan, as well as Dr. Rohan Radhakrishna and others to get feedback on a COVID-19 related tool, eventually creating, next slide, please, COVID-19 Plus My Job, which brings together all of those various agencies' rights to make sure that a client can go to one place and learn, okay, these are the rights that I have. And we've seen that it has been important, because especially during COVID-19, when there have been so many new and transient protections, we had one client who was fired after taking leave for COVID-19 and wasn't paid by her employer, who ended up having to file at 5 different agencies just to protect her rights. And in the effort of trying to make accessible tools, we also partnered with Generation Spark to create that chat bot that Sebastian mentioned, allowing people to start by explaining their need rather than the law that they were looking for to learn about their rights. Next slide, please. So working with different agencies and with the COVID-19 Workplace Outreach Project, we were able to distribute this fact sheet, as well as work together with labor to create different useful fact sheets on the topic. So we created sample letters for requests for COVID-19 supplemental paid sick leave, a guide specifically for undocumented workers as well. We also recorded a training together on all of the COVID-19 related rights to leave and pay that was distributed to worker supporting organizations across the state, as well as UCSF's training system for COVID-19 contact investigators and tracers. We also trained community faith leaders that we connected with through the California Department of Public Health, and healthcare providers and public health, partnering with Dr. Chan and the California Coalition of Local Health Officers, and training health leaders across the state, including 12 different county health departments. And while COVID-19 still continues and the need for resources related to that still continue, we know that even once the pandemic is over, people will still need to access leave and pay for their own health, for taking care of family members, for taking care of a new child. and to recover. And we're excited to keep working with all of these agencies and community-based organizations to make sure that families can continue to access these important rights, recognizing that it's not just important in a pandemic, but it's important for a lifetime. Thanks.
Thanks so much, Katie. Great conversation and wonderful presentation. So we have a full 15 minutes to ask questions of these agency leaders. And this is a small group we've invited here. It's primarily agency leaders in California, community leaders. So I've been very inspired by your presentations and working together for the last year and a half on these issues. Important advancements in collaborations, partnerships, human-centered design, and it's obvious that you're all humble public servants who seek to learn and do better for justice. So thank you for everything. So feel free to, as Julia just said, feel free to raise your hand and we'll unmute you to speak. We would love to. It looks like Teresa Andrews, your hand is raised.
Thank you. So I have a question for Adam. When you were presenting, how do you inform the community about all these resources in your website? How people will know to go there and check all the new information you have? And question for everyone. So do you consider the opinion of the target audience when designing these messages?
So I think the first question was to me about how we outreached, and there's a variety of different strategies. Of course, during this time period, most outreach has been online or via email or sort of not really in person because of the pandemic. And so in all of our speaking opportunities, we of course mention these resources and make them available. We also did direct outreach to all the organizations that we know of across the state that serve people in sort of relevant areas. Third, of course, including it in on our website. We also have a monthly newsletter and a listserv that we use. And so it's really sort of utilizing sort of every available avenue to get the word out. In addition, I haven't talked about it today, but our department did also sponsor a large public education campaign called Keep California Fair, in which we included sort of anti-discrimination messages, and through those resources directed people to our website. And those messages were directed at a lot of different communities and targeted for discrimination, including hate violence intensified by the pandemic. And I'll just mention one more thing, which is that all of our resources are available in our gateway languages, which include English, Chinese, Korean, Vietnamese, Tagalog, and Spanish. And then many of our resources are available in other languages as well. So it's very important that we make these resources available to folks in the languages that they are most comfortable speaking.
As far as the messaging piece for us, we did partnered with a community-based organization that had workers from industries that we were reaching out to. So that included, I believe last year that was like transportation workers, manufacturing, food processing, farm work. And so that organization was a union. They helped us to find different workers that would be willing to look at our messages and give us feedback about those, and they were paid for their time on that. We've also done informative interviews and focus groups throughout our process, including the campaign that we're about to do, making sure that we're getting that feedback at that initial stage, the formative stage. And then as we're developing materials, working with, again, a different community group with promotoras, and making sure that they're also reviewing our messages and our content.
I'll just add that at least with regards to CWAP, it was an iterative process for us. When we started, because of the urgency to get things out, we first created a kitchen cabinet of CBOs within CWAP that would help provide some input into the content that was being developed. For our second round of CWAP, we decided to change that dynamic a bit by, rather than having the content be created by a comms firm that the state was contracting with, we provided more funds directly to CBOs to create outreach tools they thought would be most useful. That led to new flyers being developed, that led to a mural being painted in Los Angeles, that led to other creative ideas that I think was really effective. And we assume, and I think that this is an assumption that I think we hope is a safe assumption to make, that the CBOs that we're working with have that ties to community, so they're getting direct input from workers on what that content should look like. But I have a high level of confidence that is happening, but it is one thing that is missing. So just wanted to add that bit.
Yeah, thank you, Teresa, for a great question and great description of the process. There's two questions in the chat, and since again, we're a small group of state leaders here, if you both like to introduce yourself, I think Linda Lee first, and then Jared afterwards. You have some comments and questions.
Oh, well, thanks for calling on me. It's very inspiring to hear you all describe this collaboration. I'm a little bit jealous that not to be in on the ground floor with all this, and very, very inspired. We definitely grapple with, how do you handle outreach, especially since we've been so remote. And we've been thinking a lot about the digital divide. So, naturally you're thinking, do you go paper? Do you print? How have you been approaching this question? Or maybe everything is yes and, but any other thoughts you have on this?
Yeah, I'm happy to speak to that a little bit. I mean, we also had that question. That's a super important question, and that was one that we wanted to ask in our informative interviews. In the informative interviews, we were talking to CBOs and getting their perspective on that. And then this last round, we did surveys with workers from the different industries we're reaching, and then also focus groups. And we found that for the most part, people really do want digital first, but they also want that accompanied by print. And so we are doing a mix of that. They expressed over and over again that, for the most part, people will have smartphones. Even some of the lowest wage workers were saying that they wanted that, and that they love videos, like super popular. We're also creating animated GIFs. Those are popular items, but that is definitely no way to say that we shouldn't do print. That's super important in certain contexts, and sometimes the best ways for like outreach workers to be able to hand out those materials. One thing we are doing with print that's a little different this time is we're including the QR codes so that we can actually track how that is being used. That's something that we did with Sebastian with some of our materials to make sure that, because with print, you don't often know, like when it goes out, is it being used? I don't know. And so the QR codes provide sort of a different way for us to be able to track how that's being used, who's using it, in what regions.
Yeah, not to be too redundant, I think it is absolutely a yes and type of thing. I think you have to identify, as Sarah was mentioning, there's clearly an interest in digital information now. Most workers have access to some sort of a phone. A lot have access to smartphones. So it is an easy way to get information, but I think in terms of getting that quality interaction with workers, you really need to prep advocates to be able to have those conversations with workers. And the best way is to give them something tangible that they have easily accessible, that they can demonstrate and show to workers. And that's what we've heard repeatedly, and really try to as much as possible provide our participants with printed materials. It's a challenge because you have to find money to print things in a multitude of languages, but I think it's a priority for any outreach activity that we do in the future, is ensuring that we have enough to provide groups with that either a print budget or the actual printed items to deliver to them.
Thanks, Sebastian. I just want to say, from a local government perspective, it's really inspiring to see somebody, agencies at the state, at Sacramento, being able to access community perspectives like that. So kudos to you. We try to do that at a local level, and we're learning from you as well too. So thanks again. We have a question from Jared. Jared, would you like to introduce yourself? Jared Caceres.
Yeah, hello, I'm Jed Caceres. I'm with the California Work and Family Coalition. My question was, how do you feel about sharing resources through videos versus images? Do you feel like it just depends on the target audience or the complexity of like the resource you're talking about? And did certain formats do better or get more traction? You did say like videos were better. Was it like YouTube or like Reels, or if you could talk about that, that'd be amazing.
Yeah, probably Sebastian and I can both talk about it. I mean, yeah, videos performed super well. We played ads before YouTube videos, and then we had the kinds of like Google ads that will appear on different pages as you're, on them. It would, maybe pop up kind of thing. But yeah, videos definitely performed the best, but that's not to say that the static items didn't. It sort of depended what the content was of that particular static item. A lot of our stuff related to vaccine promotion, because there was so much happening at that time, not so much interest, but workplace protections, like what is an outbreak and what is your employer supposed to do if there's an outbreak? It was something people didn't know a lot about. We were getting a lot of hits on that, a lot of interaction. So I think it sort of depended on the content. I definitely want to continue to do both static and video. And like I said, build in some other innovative things like innovative GIFs. We're going to be doing carousel graphics, just trying to put it out there in a lot of different ways.
Terrific. Thanks, Sarah. Yeah, anybody else? So this has been a great discussion, and Legal Aid at Work and all the partners are going to send a survey to everybody that's registered. I think there were maybe 80 people that registered, and also the presentations. So feel free to forward those. The survey is going to be important because such collaborations are going to be important, and they need to be built upon. Certainly great progress in terms from a governmental bureaucracy perspective, but to actually reach the people who needed this the most, we still have a long ways to go. So we need to be on this journey together. So as a final wrap up, I'd like to ask all of you for kind of the main, a big lesson learned from this. We definitely need to come out of this pandemic stronger than ever. So what are some lessons that you've learned as part of this partnership and this work? Maybe we'll start with in the same order as we went with Sarah first.
Well, I think a big lesson for us in this was it was great how quickly we were able to develop this relationship with labor. We had somewhat of one with them and with PIR, but something that I really want to work on moving forward is continue to have the stakeholder building and engagement happening really organically. In some ways, maybe sometimes slowly, just a lot of conversations, kind of those areas of it that I emphasized on the pyramid, that is a lot of just meeting people, listening to them, like what are your needs, really like understanding what their needs are, sharing what some of yours are, looking for opportunities to find that like crossover. So I'd like to focus now when it's not as much of the surge, where things are a little bit more calm, so that the next time if something really big like this comes about, it will just have so many more options. It won't be quite as like, how are we going to do this? Who are we going to turn to?
Awesome. Thank you. Sebastian?
Yeah, I think the biggest lesson is that I've taken away from the past 2 years is that we need to have dedicated streams of funding for this type of work. A lot of what has come out, the Navigator, the Safer at Work Microsite, the collaboration only came because the legislature gave us funds to do this work, and then labor agency had previously put in a budget request for that had been approved. But without it, our agencies have a lot of work on their hands. Our people have a tremendous amount of responsibility, and adding additional tasks to them without giving them staff that's dedicated to it is really difficult. And it's part of the reason why a lot of state agencies are hesitant to jump into doing this type of collaborative work, because it's just adding a new stream of work and it takes up a lot of time. So I think that that's super critical. It's incumbent upon us in government to make sure we're developing our agencies and our departments to have teams that are devoted to doing community engagement, community outreach, and really focusing on creating this type of content and partnerships. So I'll pass it along to Adam.
Thank you, Sebastian. Adam?
I agree with everything Sarah and Sebastian said, and I would add that there's a need to institutionalize this work within our departments and across the government, that it can't be dependent on individual staff members or leaders, but rather it has to be infused within the work of our departments and through norms, if not policies, around the importance of cross-agency work and working with community-based organizations and hearing from the public about how we can do better and how we can help connect the dots and help people access our services. So that for me is something I feel very focused on, making sure our department at least takes this to heart.
Thank you, Adam, for taking it both to the brains and the heart. And Katie, since you represent clients and families across California still and still see them on a regular basis, what are your final words of wisdom, and maybe you can close us out?
All right, it's hard to follow these three, but yeah, I think from all of the partnerships during the pandemic, we've just seen like what can be accomplished when folks get out of their silos and work together. And we've seen, especially I think looking at CWAP, that COVID-19 worker outreach project, how many millions of workers learned about paid sick leave, where it was something that, like, walking down the street, you might hear somebody talking about SB 95 I have for COVID-19 supplemental paid sick leave. So just how impactful it is when agencies work together and really have that worker or family centered approach, looking at what does it look like for that person to try to learn what they need to do and what rights they have. So I am so grateful for what that work has been, and always have in mind the fact that, even though hopefully someday soon, not everybody will be in a health crisis at the same time, for those families that have a parent who has cancer or a spouse who has a heart attack or children with disabilities, these challenges will still continue and still be just as impactful for that family and that community. And just how we can learn from this to apply it to general paid sick leave, general job protection and family care, and paid leave, to make sure that families can take care of each other without losing their job, even outside of a pandemic.
We just want to thank you again for joining us, and keep an eye out for the recording. Thanks so much.